Let's continue our discussion on the kidney channel. We now discuss the kidney sinew channel. First, to explore its pathway. The kidney sinew channel originates beneath the little toe, diagonally crosses the sole of the foot, meets the spleen sinew channel, and continues to the medial malleolus where it binds. From here, a minor branch travels to the medial portion of the calcaneus. The main branch ascends to the posteromedial aspect of the leg, binds at the medial condyle of the femur, crosses the bladder sinew channel, ascends to the posteromedial aspect of the thigh to the genital region to REN 3 and REN 2, where it meets the other yin sinew channels. It then penetrates the abdomen, runs along the spine to the nape of the neck, and there meets the bladder sinew channel. From the genital region, an internal branch traverses the gluteal region and follows the deep musculature along the spine to the occiput, where it meets the bladder sinew channel. Its clinical importance. Pathological signs of the sinew channel will manifest with spasms on the sole of the foot, pain or spasms along the posteromedial aspect of the lower extremity, the back and occiput. Chronic B syndrome, epileptic seizures, limited range of motion with spinal flexion and extension, degenerative disorders of the bones and joints, spondylosis, and osteoarthritis. The sinew channel is indicated mainly for chronic pain, spasms, and cold sensations of the lower back and spine, accompanied by limited range of motion. Again, the pathological symptoms of the kidney sinew channels are the following: cramping of the bottom of the foot, cramping and pain along the course of the channel, convulsion and spasm associated with epilepsy. If the disease is on the exterior, the patient cannot bend forward. If the disease is on the interior, the patient cannot bend backwards. Thus, in a young disorder, there will be inability to bend the lumbar spine forwards, whilst in a yin disorder, here will be inability to bend the lumbar spine backwards. It is by virtue of these functions and relationships, as well as the channel pathways discussed before, that many of the actions and indications of the points of the kidney channels can be explained. This can be summarized as: first, routing pathologically ascending heat, qi, yang, and wind. The kidneys are the bottommost zhang and the root of the yin in the body. When yin is deficient, deficiency heat or uprising yang or interior wind may ascend to the throat, ears, eyes, and head. Points of the kidney channel are frequently used clinically both to nourish yin, that is, kidney 3, and to strongly descend pathogens from the head, example, kidney 1. Nourishing yin and clearing deficiency heat in the treatment of night sweating, wasting, and thirsting disorders, and others. Next, nourishing liver yin to counteract uprising of liver yang in the treatment of headaches, dizziness, and others. Next is nourishing kidney water to balance excessive heart fire and harmonizing the will and the spirit in the treatment of restlessness, insomnia, poor memory, palpitations, epilepsy, mania, susceptibility to fright, and others. Next is rooting the qi and harmonizing the relationship between the kidneys and the lung in the treatment of cough, coughing with blood, dyspnea, asthma, and wheezing. Another is tonifying kidney yang to strengthen the kidney functions of dominating water in the treatment of edema and deficiency type urinary disorders. Also tonifying kidney yang to strengthen the libido in the treatment of impotence, seminal emission, and others. Next is tonifying kidney yang to warm the lower body, legs, and feet, and benefiting the throat, especially in the treatment of sore and dry throat or loss of voice due to yin deficiency. It's also for strengthening the lumbar spine and benefiting the teeth, benefiting the ears in the treatment of tinnitus and deafness, regulating the conception and penetrating vessels, and treating diseases of the uterus such as infertility, disordered menstruation, uterine prolapse, postpartum disorders, etc. Next, draining damp heat from the lower jaw and regulating the function of the bladder and intestines in the treatment of difficult urination, retention of urine, painful urinary dysfunction, dark urine, diarrhea, dysenteric disorders, swelling, itching and pain of the genitals, Shan disorders, hypogastric pain, etc. Finally, nourishing kidney yin in the treatment of constipation due to dryness.